Is diabetes reversible? Many people with this condition are asking this very question, hoping for a path to better health and a brighter future. As diabetes, particularly type 2, continues to rise, the possibility of reversing it through lifestyle changes and medical interventions is a beacon of hope. Today, we'll explore this topic. We did thorough research just to answer this question, so if you want to know if diabetes is reversible and how to make it happen, watch this video till the end, and don't forget to like, share, and subscribe. Diabetes management and potential reversibility depend on the type of diabetes a person has. According to some studies, it's possible for some people to reverse type 2 diabetes. Actually, the more accurate term to use is remission, not reversal, as the risk of getting diabetes still exists, even if your blood sugar levels are normal without medication. On the contrary, with type 1 diabetes, there's currently no cure or way to put it into remission. However, ongoing research is already underway. Remission means achieving normal blood sugar levels without the need for diabetes medication, but ongoing lifestyle changes are crucial to maintain these levels. With type 2 diabetes, there is already significant potential to achieve normal blood sugar levels without medication, and we'll explain how later. Numerous individuals have already shared their stories of achieving remission from type 2 diabetes. But before we cover how those people made it, let me first explain the difference between type 1 and type 2 diabetes, so you'll have a better understanding of how it can possibly be put into remission and how it's not. Type 1 diabetes is considered irreversible, primarily because it involves the destruction of insulin-producing beta cells in the pancreas, which leads to a permanent deficiency of insulin. In simple words, in type 1 diabetes, the body's immune system mistakenly attacks and destroys the cells in the pancreas that produce insulin. While the exact cause remains unknown, factors like genetics and exposure to viruses may contribute. As a result, the pancreas is unable to produce enough insulin or, in many cases, may not produce any insulin at all. Without insulin, the body cannot effectively use glucose from the bloodstream for energy. This can lead to high blood sugar levels. So, what's the problem here? The problem is the beta cells in the pancreas that produce insulin are damaged. This is why type 1 diabetes occurs. Since this is the cause of the problem, to stop type 1 diabetes, the insulin-producing beta cells in the pancreas that were destroyed by the immune system must be repaired. However, right now, complete cure remains challenging, and current treatments focus on managing the condition rather than full reversal. The only way to manage it is through lifelong insulin therapy through injections or insulin pumps, regular blood sugar monitoring, and a healthy diet and exercise. Adjunct therapies and advanced technologies like continuous glucose monitors and hybrid closed-loop systems or artificial pancreas also play significant roles in managing type 1 diabetes. The question is it okay if you don't take insulin with type 1 diabetes? Not taking insulin with type 1 diabetes can lead to serious health consequences, even death. Here's why. High blood sugar. Without insulin, the body can't move glucose from the bloodstream into cells for energy, leading to high blood sugar. Diabetic ketoacidosis. When cells are starved for glucose, the body breaks down fat for energy. This leads to a buildup of acids called ketones in the bloodstream. This condition, known as DKA, can cause nausea, vomiting, shortness of breath, and even coma if left untreated. Long-term complications. Chronically high blood sugar can damage nerves, blood vessels, and organs throughout the body. This can increase the risk of heart disease, stroke, kidney disease, blindness, and nerve pain. While there's no way to repair the damaged insulin-producing beta cells in the pancreas as of now, there's ongoing research focusing on methods to preserve remaining beta cell function, improve insulin delivery systems, and potentially find cures through therapies such as beta cell transplants or immunomodulatory treatments. Now let's cover type 2 diabetes. Type 2 diabetes occurs when the body becomes resistant to insulin. Cells can't absorb glucose properly, leading to high blood sugar levels. But what makes it reversible compared to type 1? Unlike type 1, where the insulin-producing beta cells in the pancreas are damaged, type 2 diabetes involves insulin resistance that over time can lead to a decline in insulin production. So the problem here is insulin resistance, and in order to achieve remission, you have to make your body respond to insulin and not resist it. But before you do that, you have to understand what causes insulin resistance. Insulin resistance occurs when cells in your muscles, fat, and liver don't respond effectively to insulin. It can be caused by genes, lifestyle factors like poor diet and lack of exercise, being overweight, hormone issues, some medications, and getting older. Now that you know all these factors that contribute to insulin resistance, to achieve remission for type 2 diabetes, you need to start making some changes. Of course, except for having a family history of type 2 diabetes and aging, you can't change that. But with other factors, especially lifestyle changes and diet, you can make a big difference. To achieve remission, here's what you can do. 1. Weight loss. If you're overweight or obese, shedding excess weight can significantly improve insulin sensitivity. Aim for gradual weight loss through a balanced diet and regular physical activity. Weight loss has been shown in studies such as the DIRECT trial to lead to remission in a substantial number of individuals with type 2 diabetes. 2. Healthy eating habits. Include plenty of fiber-rich foods like fruits, vegetables, and whole grains. These help stabilize blood sugar levels. Opt for lean proteins such as poultry, fish, and legumes, and healthy fats like avocados, nuts, and olive oil. Limit your intake of refined carbohydrates such as white bread, sugary snacks, and pastries, and added sugars. 3. Portion control and caloric intake. Be mindful of portion sizes. Eating smaller, balanced meals throughout the day can help regulate blood sugar levels. Monitor your overall caloric intake to maintain a healthy weight. 4. Physical activity. Regular exercise is crucial for improving insulin sensitivity. Aim for at least 30 minutes of moderate intensity activity most days of the week. Activities like brisk walking, dancing, or swimming can be effective. 5. Proper medication. Medications are still needed until you achieve normal blood sugar and come to the point that you won't need them. By doing all these steps consistently and managing your glucose levels, you may reach and maintain normal blood sugar levels without medication. However, this doesn't mean you're completely cured. Type 2 diabetes remains an ongoing disease, even if you're in remission, meaning you aren't taking medication and your blood sugar levels stay healthy. There's always a chance that symptoms will return if you go back to your unhealthy old habits and stop doing the tips mentioned in this video.